name is not Edith, but Faith. I'm Faith Nashipai. I'm here representing Thriving Families Kenya, a psychosocial service provider and consultancy. Thriving Families also happens to be a partner with the State Department of Gender, and we actually advocate for the rights of men and boys in gender equality. So part of what I'm going to talk about is a lot to do with men and boys, and thanks my brother Eddie for highlighting that. The National Gender and Equality Commission 2015 report on the status of the boy child in Kenya confirmed the exclusion of the boy child. Part of it was, and he said that the exclusion is pushing the boy child and to a loss of confidence and low self-esteem. The impact of the exclusion was likely to manifest itself in increased violence, truancy, addictions, and a social net effect was projected as failed marriages, dysfunctional families, and high incidences of GBV. Are we having that today in the country? That was a projection. I'm not sure we do a lot with the reports that are produced. So it is important that we actually look at some of these reports and focus on them as a nation. And on that, I happened to have attended the policy, the launch of the policy of the National Gender and Equality Commission. And I had one commissioner who actually stood up and said, because someone asked, where is the boy child in your policy and in your next 5 years? And one commissioner mentioned that they support the girl child. So we who want to support the boy child can go ahead and support the boy child. And I wondered, why then do we have an equality commission that is only supporting women and girls? So I want to request the government to make sure that we have this inclusion of the boy child. As part of this, Thriving Families Kenya has come up with a community strategy where we are engaging men. Our desire is to see that the Ministry of Health supports us in training the champions that we come up with at the community level. These are not community health workers, but they are people who are known in the communities and the villages, and they are people who would be the readily available persons within the community when a man is having a mental breakdown. We are also spearheading, and thank you, Eddie, we are spearheading a 1 Million Men campaign, where we intend to have a lot of mental health issues discussed, as well as gender-based issues as far as men are concerned. Speaking to the Maendeleo ya Wanaume chairman, he mentioned that we have a lot of issues that go into mental health as far as men are concerned. When a man is sodomized and he goes to report at a police desk, how is he treated? Does he even get the rightful care that he deserves? When a man has been beaten up by his wife in the house, he's seen as a low man. He's a lesser gentleman, or actually, he's a lesser man. So we need to destigmatize some of these ideologies that we are having as a country so that we can make help-seeking behavior for men a better way of getting these services. We can be offering good services, but if we are still stigmatizing men, we are not helping them. The boys in the universities who are gang raped, it happens in Kenya, they go through the care, the physical care. But at the end of the day, these boys end up in depression and they end up succumbing to suicide. So we need to look at all this and say, we have a challenge in our society. And then, when we are talking to girls in schools, we talk to them, we empower them on personal development and understanding of their persona, but we do not address the boys. And then the boys impregnate the girls. And we have a psychosocial issue right there. And the boys do not understand that at 11 years, they can actually make a girl pregnant. So them in their position of curiosity and from their premise of trying things, they end up committing problems I mean, they end up creating problems that they are actually not aware about. So let us educate our boys. If we are going to save Kenya in the next 40 years, we cannot work without our small children in the schools who are our small boys. And we cannot just talk about our youth, because our children will be our youth tomorrow. And when we look at the population pyramid, the kids are more down here. Then look at, thank you. When we are looking at coordination and resources, and this is more on the systemic issues that we are going to have from this discussion, I want to submit to this task force that let us have the Paris Declaration in mind, where we are having coordinated resources for donors. Because we've had a lot of wastage with the HIV and AIDS agenda, until at some point, yes, we had to come to reality and put all our resources together. So I think that is a very important thing for us to do. Then on matters to do with referral systems, councillors will refer people. But at the community level, where do you refer? Could we have a linkage? Could we have the Ministry of Health give us a clear guideline on referral system so that we can give life to the primary health care? Thank you. Just one more, and a final one, is establish rehabilitation facilities for men. And this I say, when people go through gender-based violence, we do not take care of them. Our young boys are actually put in, the boys who are defiled, they are put in juvenile facilities. Could we have facilities that are taking care of our boys? Thank you so much. The rest is in my submission.